Welcome to this COVID talk. I have the pleasure to have with me Dr. David Barbe. Dr. Barbe is the president-elect of the World Medical Association. He is former president of the American Medical Association, and he is a family physician in Mountain Grove, Missouri. Good evening, Dr. Barbe.
Good evening, Dr. Kloiber.
We have heard today from the President of the United States that he expects a worst-case scenario of 200,000 people dying from COVID-19. Currently, we have 200,000 documented cases of infection in the United States. We have more than 4,500 people who already died from the disease. With that, the United States have become the new hotspot of the COVID-19 pandemic. How do you see the situation in your country developing?
All right. That is not such a great honor to now have more COVID cases than any other country, but it perhaps is not too surprising. Most of our cases right now are occurring in the very large metropolitan areas, New York, Chicago. Of course, it seemed to start in this country in Seattle. Los Angeles also has a lot of cases. In the Midwest part of the country, and particularly in rural areas, the number who have been documented to be positive and the number of deaths has been, of course, much lower. The estimates over the next 4 to 6 weeks are that between 100,000 and 200,000 deaths across the country can be expected. In almost all areas of the country, the number of positive cases is expected to rise steadily over the next 2 to 4 weeks. Then the peak of the deaths will occur very slightly after that, or is expected to. So we expect to see our peak of daily deaths probably peak sometime in the later part of April. The total deaths then level out a few weeks after that. But as with any projections, there is a wide range. And as I say, conservative projections suggest maybe 100,000 deaths, and somewhat more aggressive or worst case scenarios suggest, as you said, maybe 200,000.
In most of the countries which have peaked over the last weeks with the coronavirus, especially in Europe, we have seen very strong restrictions on social contacts. So we speak about physical distancing that has to be observed. We have even lockdowns in most of the countries in Europe right now. What are the measures in the United States in order to reduce the speed of this pandemic in the country?
We do have the luxury of seeing what has worked in other countries, and we are following suit. And I may say that I think many other countries in the world look at the United States as sort of a cowboy nation, many very independent-minded individuals. So for city mayors and for governors to declare what we are calling shelter-in-place orders is very atypical for the United States. But I am pleased to say that many jurisdictions, many large cities and states have implemented shelter-in-place rules. They are not strictly enforced, meaning the police forces are not patrolling the streets and taking people off the streets if they are out there. But most people are voluntarily restricting their activities. Many non-essential businesses have been asked to close, and they have. That is especially true in the service industries like restaurants and bars, non-essential gatherings. Almost all of the churches and synagogues in this country are no longer holding live worship services. So that is true across the country. In areas where the rates of infection are the highest, those are the most strictly emphasized and enforced. There are still about 15 states who have not, and on the statewide level, implemented shelter-in-place restrictions. But by and large, we are observing those things that have worked in other countries.
In some of the more rural parts, the curve is picking up slower, and you haven't seen that many cases, although I think now every state in the United States has seen corona cases. If that comes later, and maybe at a point where in other parts, like for instance in the big conurbation areas, it is already on the decrease, aren't you risking a second wave then being imported from the rural parts to the more conurbation parts?
So that is that has been considered, and that can happen even in the other areas as well. I do share your concern that when we begin to relax the restrictions, and we don't know yet when that will be, the president has just asked us to extend the highest levels of precaution for the next 30 days. And some have asked, some on an individual state level, some governors have already asked that be extended into the summer. But what you say is true. We do expect the wave to be a little later. What we hope is that those who have already been exposed and had the disease have formed protective immunity. So those that are not sick this time do need to be very careful as some of the restrictions are lifted, as people begin to be more mobile, as people are returned to work, because that is a very significant conversation right now. When can we get some of these places back to work, particularly those that are the critical workplaces are still working, but those that are on maybe the second tier, they need to be back to work. One of the approaches that has been discussed is more widespread testing. Even though the United States has tested more individuals, we have still tested only a very small portion of our population. And if we have widespread availability of rapid tests so that that can be tested in communities, we can identify infected cases, we can identify infected contacts, more effectively isolate those individuals, then we believe that we can reduce the secondary wave that you referred to. But without testing, there will be a second bounce, I'm afraid.
That brings me to another question, and that is the one about the supplies and the supply chains. What we have seen now nearly everywhere is that we are short of supplies, whether that is personal protective equipment or high-tech equipment, like, for instance, ventilation machines for ICUs. I guess that's the same in the United States. Even so, a lot of those things have been invented and first built in the United States. I think you are suffering from a lack as well there. Is that true?
That is true, but it is not evenly distributed. There are some areas, especially those large metropolitan areas, and New York has been most in the news here, probably internationally as well, for expecting a very severe shortage of not only regular hospital beds, but intensive care unit beds and ventilators. There is a lot of activity in this country now to use the U.S. Army Corps of Engineers to help retrofit buildings. And the most commonly used building here is a convention center, a very large open space that can be built in for hospital rooms. And so literally thousands of hospital rooms and beds are being constructed right now in almost every major metropolitan city. I checked this morning, and Los Angeles and Detroit and New York and Dallas are all converting their convention centers and other similar large buildings into hospitals. Most of those will be for lower acuity patients. Some of those are going to be set up specifically as COVID hospitals, and the high intensity monitoring and ventilators can be brought into those areas. So it is a mixture, but we are significantly increasing the capacity. However, we can't as quickly produce more ventilators. So in some areas, there will be a relative shortage. Right now, we are trying to look at the logistics of moving ventilators from areas where they are not immediately needed. Let's say Missouri, the state of Missouri where I live. We are not projected to have a shortage of ventilators in Missouri. So perhaps we should share with Chicago or with Dallas, somewhere in the Midwest. And then later, if there's a peak and if we find that we are getting, a little short, perhaps some of those can be brought back to the state. So we're looking at a lot of very creative ways to try to provide the high-tech equipment where it is needed at the time and then redeploy it to other areas when it is no longer needed.
Would it vice versa also be a solution, for instance, to bring patients out which need ICU treatment to other places which are not that hit hard?
Yes, that has been discussed. It is a little more difficult to transport patients over very much of a distance, and our country is very large, and to transfer a patient from Chicago to St. Louis, for instance, that's 6 hours by land, between 4 and 6 hours by land, a little less by air, but to transfer very many people that way is a logistical challenge, and to support them en route.
We are now looking all forward to get a vaccine for COVID-19. However, that will take some time, and it may be at a time when it's too late for this pandemic. On the other hand, there are also some trials going on with antivirals that may be promising, or with other medicines, like for instance malaria medicine that are being used. Is there any guess what has the highest chance of being effective even in this pandemic?
As you say, the potential for the hydroxychloroquine and azithromycin combination to be helpful seems to be the most popular and leading experiment or trial right now. There's a mixed opinion among the experts in the United States as to whether or not that trial will in fact prove successful. The other antivirals probably have greater longer-term likelihood, and also some of the biologics seem to have some beneficial effect on boosting the interleukin defense mechanisms in the body and help the body fight off the virus more effectively. These are mostly, my understanding is lymphocyte-mediated or responsive infections, and so if we can boost the leukocyte response and effectiveness, then that would be a way for the body's own defenses to fight off the virus. On the topic of vaccines, and I'm speaking personally, and I am not an expert, so take this for what it is worth, we have some vaccines that have been hugely successful. We wipe out diseases like polio with very effective vaccines. On the other hand, some of our viral vaccines, like the influenza vaccine, are only modestly effective. Do they help? We think they do. But are they the final word on eradicating or perfectly protecting our population from this particular virus? My personal belief is that they will not be. So while I hope that I'm wrong, I hope that the vaccine that is eventually, or vaccines that are eventually developed will be highly effective. If our experience with some of the more recent viruses, influenza viruses, the varicella virus, those vaccines are only partially effective. They may reduce the transmission rate some, the infection rate some, and the intensity some, which is good. It will save lives. But if we think we're gonna wipe it out like we wiped out polio in the developed countries, I think we're probably not going to that extent.
Dr. Barbe, thank you very much for those insights. Let's hope that the grim scenario which the president painted today will not be a record that will be achieved. And let's hope that this is over sooner than later. Thank you very much.
Thank you. We all pray for that same thing.